Hello everyone. This video is a continuation of our series on ergonomics. I have already discussed various aspects of ergonomics in my previous video. If we were to simplify ergonomics, it is a study of our job. It is a science of designing the job to suit the worker rather than fitting the worker into the job environment. I came to a conclusion that ergonomics as a science involves three main aspects: the operator, in our case the dentist, the work environment, and third, the tools and the equipments associated with it. In today's video, I shall cover the aspect of ergonomics associated with the operator, that is the dentist, and forthcoming videos we shall cover the tools, equipments and the workstation. So let's begin. As dentists, we are at a high risk of musculoskeletal disorders due to several factors. Because we repeat the same motions over and over again during the day, we work in awkward, stationary positions for long hours because of application of excessive pressure, sometimes because we subject ourselves to excess vibrations and many other factors. Job. The posture at work affects our neck, our shoulders, wrist, fingers. It affects our back, the upper, middle, lower back and even the legs. So how do we handle this? Because our work postures are unavoidable. This got me thinking, and I consulted several senior physiotherapists and fitness experts to understand how to deal with this issue. Quite naturally, there were some solutions to fix this problem in the form of exercises involving strengthening exercises, mobility exercises and stretching exercises. So these exercises can fix the problem to a certain extent. So these exercises, when performed every day, regularly, can help in taking care of the muscles of the joints which become weak and stiff due to the kind of work pressure that we are subjected to. And what I did is I requested one of our fitness experts, Mr. Nanesh, to demonstrate a few of the easy exercises for us. And I truly hope that this video, the information as well as the exercises will be of great benefit to all of us dentists.
This is for the lumbar, the lower back. A very simple exercise which can be done easily. Sit comfortably with the knees bent at 90 degrees, shoulders out, sitting straight, sitting tall, absolutely comfortable. Now, take your abdomen in, stomach in towards your spine. Pull your stomach in towards your spine and hold. Hold for 1 or 2 seconds and gently release. Ensure you're sitting straight. It's a very easy exercise. Once again, pull your stomach in towards your spine. Hold for a few seconds and gently release. This is a very simple exercise which can be done, say, up to 10 times. It can be done 2 to 3 times in a day. At work, it can even be done when you're working. You can activate your core even when you're standing or when you're working in your sitting position. A very beneficial exercise, at the same time very simple to perform and can be performed by all age groups. One of the simplest exercises recommended in the video. Now we'll move on to stretches of the neck. Let us perform some stretches for the neck. Sit straight and tilt your neck to one side such that your ears are almost touching the shoulder and hold. Hold for 2 seconds and then go back to your original position. Now tilt to the other side such that the ears are almost touching the shoulder and hold for 2 seconds and then again go back. Do this, say, around 10 times and hold each time for 2 seconds. Now we will try rotation of the neck. Very simple exercise. Turn your chin to one side onto your shoulder and now make a half circle as you move your chin to your right side. Stay there and now again make a half circle as you rotate it to your left. Do this 15 to 20 times slowly. Now another simple exercise for the neck, that is, it can be again easily performed anywhere. It's called the chin tuck. The chin tuck is nothing but tucking the chin inwards and holding it that way for 5 seconds under pressure and then releasing it. It's a very simple exercise if performed slowly and carefully, very effective, and can be performed anywhere, including at work in between patients. Can be done many times in a day when time permits without any additional equipment. That sums up for the exercises of the neck. Now the stretch for the spine. It's a very simple exercise where you sit straight with your knees bent at 90 degrees, palms resting on the knees, and now you will curl the spine. You will begin from the cervical, move to the thoracic, up till the lumbar. When you begin curling, you will start from the cervical and you will imagine that you are curling each vertebra one by one as you curl. From the cervical, you will move on to the thoracic. One by one, the vertebra is curled, and then to the lumbar, up till the tailbone. Once this is done, you will carefully curl back and sit straight. This is a very simple way of stretching the spine. If it is done carefully and slowly, it will give you optimum results and ensure good mobility and stability to the spine. These exercises are very simple and can be performed at any time of the day by any age group at work without any additional props. I thank Mr. Nanesh for providing us this useful demonstration. Let us perform exercise for the upper trapezius. A very simple exercise. Turn back, face the wall, stand as close as possible to the wall with your abdomen in and neck neutral. Place your arms up so that they are in line with your shoulder. Once in position, gently retract the shoulder blade as far as you can and hold for a second or two. Release. Repeat the same process. Hold for a second or two and release. This can be done, say, up to 10 counts and hold for at least 2 seconds each time. It can be done 2 to 3 times in a day when time permits. Now we will see another exercise which can be performed for upper and lower trapezius together. This is again a simple exercise and can be performed by all age groups and can be done up to 2 to 3 times in a day. Similarly, turn to face the wall as close as possible. Stomach in and neck neutral. Palms facing posteriorly or backwards. And now retract the shoulder blades. Retract them, and as you do so, raise your arms up as far as it goes and hold. Hold it for a few seconds and then gently release. Repeat the same process. Retract the shoulder blades, raise your arms up and hold few seconds and then slowly release. Can be done up to 10 counts. Hold for 2 seconds minimum and try to do it